mynews.studio.
Newborns in the Maldives are now born into a world without HIV, syphilis, or hepatitis B. So, how did they manage to achieve that?
Today is October 17th, 2025. The Maldives has just made global health history. The World Health Organization has officially recognized them as the first country to eliminate mother-to-child transmission of HIV, syphilis, and hepatitis B. So walk me through it. How did they reach this point?
It's a major achievement, and it didn't happen by chance. The Maldives spent years building a public health system that truly reaches everyone, even their most remote islands. Over 95% of pregnant women receive antenatal care, and almost all are screened for these three diseases. That means most infections are caught before they can be passed on. But let me ask, why is that level of coverage so rare in other places?
A lot of it comes down to resources and national priorities. Many countries have trouble reaching remote communities or providing care without cost barriers. The Maldives, though, spends more than 10% of its GDP on health. That's a big commitment, especially for a small island country. They've made maternal and child health a top priority. But is it just about the money?
No, it goes beyond funding. It's about having the right systems. Universal health coverage makes the difference. Every resident, including migrants, gets free antenatal care, access to vaccines, and diagnostic tests. Immunization rates are impressive too. Over 95% of newborns regularly receive the hepatitis B birth dose and finish the vaccine series. Consistently maintaining that year after year is not easy.
And the impact is clear. In both 2022 and 2023, not a single baby in the Maldives was born with HIV or syphilis. Plus, a 2023 national survey found 0 hepatitis B cases among young schoolchildren. That's not just data, that's thousands of healthy kids. But I'm curious, how much did partnerships and political leadership matter?
Political leadership is crucial. The country's leaders treated this as a promise to their people. The health minister described it as a moment of pride and a sign they'll keep investing in health. But they didn't do it on their own. Collaboration was key. Government agencies, private companies, civil society, and groups like WHO and UNAIDS all worked together. That meant better screening, outreach, and technical support. Why does this matter for other countries, though?
Because it shows that even smaller or less wealthy countries can reach ambitious health targets. The Maldives is proof that universal coverage, steady investment, and cooperation can eliminate diseases that were once seen as unavoidable for newborns. But do you think it's realistic for others to follow the same path?
The model is there, but it takes serious commitment at every level. It's not just about duplicating a program. It needs ongoing funding, reaching out to the most marginalized, and careful monitoring of results. The Maldives isn't stopping now either. They're looking at digital health tools, better laboratory systems, and reaching even harder to access groups. So the effort continues.
And this isn't just a national achievement. It's a message to the world that stopping mother-to-child transmission of HIV, syphilis, and hepatitis B is possible. Millions of babies are still at risk globally, but now there's a clear example to follow. What's the next challenge ahead for the Maldives?
Now, the focus is on keeping these results and expanding progress in maternal, child, and adolescent health. The WHO will keep offering support, but the country is already working on digital systems and involving the private sector even more. The main thing is to keep up the momentum.
So, just to sum up, the Maldives invested in universal healthcare, kept maternal and child health at the center, achieved high vaccination rates, and built strong partnerships. The outcome? The first ever elimination of mother-to-child transmission for 3 major diseases. And their work isn't finished.
We started by asking how the Maldives freed its next generation from these infections. Now we know it's about long-term commitment and care that includes everyone. There's a lesson here for the rest of the world.
Thanks for joining us to discuss the Maldives and their historic health milestone. We appreciate you listening. Today's episode was brought to you by mynews.studio. Try it free.